In this week's episode of the Midlife Mentors, we're joined for the second time by the wonderful Katie Armstrong, GP and founder of Clinic 51 in West Sussex. The previous podcast with Katie was such a hit as she talked us through the ins and outs of perimenopause and the menopause, as well as HRT.
So we couldn't wait for her comeback for this episode to share specifically how best to approach your GP if you think you have symptoms. This is such an incredibly useful discussion, insightful, empowering and balanced. We know this is going to be invaluable to so many of you. Hi, I'm James Davis.
And I'm Claire Davis.
We're the Midlife Mentors, here to lift the lid on how to achieve health and happiness.
The balanced, no-nonsense way.
Hello and welcome to another episode of the Midlife Mentors with me, James.
And me, Claire. How are you all? Well, we have been up to lots and lots of things, haven't we? We've been out and about.
We've been to Marbella to run our retreat.
We have been to Marbella.
Amazing. We took a little break in Ibiza, which was lovely.
Yes. So we worked out that we haven't been there since 2020 when we left. So obviously anyone that has listened to the podcast for a while now knows we used to live in Ibiza, and James was there 10 years. I was there 6. And when the pandemic hit in 2020, we decided to pack up our flat and leave Ibiza, which was a big decision. Big decision. Move back to London, which is where we still are. But it was just amazing to go back to Ibiza and
fantastic,
and to do our lovely retreat at Punta Romano, and that was just wonderful to spend quality time with people. You know, we get our energy off of being with people in person, so it's really, really nice that we can do more retreats now. The world has opened up a little bit more.
I know, and that's a wrap for retreats for 2022.
It is.
But some exciting plans for 2023.
Yeah, and
I can't talk about yet.
No, and I also said to James, I just dropped a little bomb on him yesterday. I was like, I want to do more retreats again. I want to do lots more retreats. He's like, okay.
I was going to say, listeners, watch this space.
Yes, watch this space, because it might not just be in Marbella. We might be running them in Ibiza again. Dun, dun, dun.
All right, so without further ado, let's welcome this week's guest, and it is Dr Katie Armstrong, GP, founder of Clinic 51 in West Sussex. Hello, Katie.
Katie, you're back.
Hello, guys. It's so nice to be back.
It's really lovely to have you back.
On.
So
I'll come to Ibiza.
Yes, Katie, that would be amazing. Come. We were just talking about retreats before we jumped on. You can come to one of ours. So I have to say, one of our most popular episodes of the Midlife Mentors podcast has been the one that you were on before. We had so many people reach out to us and say, oh my goodness, I've recommended this podcast to so many of my friends, and it was just, if you haven't listened to this one, well, if you haven't listened to that one yet, go back and listen to that and then follow up with this one, because it was full of such insightful information. I mean, I walked away from that going, oh my goodness, I didn't know that. I didn't know that. And it was just, it's super, super helpful to help women feel like they're not going crazy, not going mad, and some really great strategies of how to move through the perimenopause and the menopause time of their life. So thank you for that, because it was so popular and really well received.
Oh, my absolute pleasure. And I think, as I said last time, you know, I've been a GP for over 20 years, and but it's only even going through my own perimenopause that I really understood actually how little I knew about it as a GP who was a women's health expert. And through my own journey, through that of my friends and through my patients, you know, it is just such a joy to share the learning that I've done myself. And you know, knowledge is power. If you understand how your body works, if you understand what's going on, then it gives you control. Yeah. And we all need to feel like we're in control, and perimenopause and menopause is a time when you can feel pretty out of control. So it's brilliant to be back.
Oh, thank you.
So
you know,
you
one of the things I always use, one of your analogies, I've completely stolen it, Katie, of the light bulb going perimenopause. I say it to so many people, you know, because that was a light bulb moment, pardon the pun, of for me, of the perimenopause is like a symptom here, and then it might go, and then another one pops up. It's like a light bulb going on and off, and they're not enough to compound to a point where you think there's something really, really wrong, because they're going on and off, and then you think, did I imagine that? Where's that one gone? And it was such a light bulb moment for me.
And I think probably, you know, and I spend a lot of my time, if I'm walking the dog or, you know, as I'm drifting off to sleep, thinking about how do I make this easier to understand? Because, you know, again, I mean, I've been to medical school. And so I think often doctors will talk about the way the body works and presume knowledge. And I think that that can be really hard when you're a patient. So just trying to have little ways to think about, oh yeah, I get it now, that's what's going on. And I do think the whole, you know, the lights are on when your ovaries are working. When you're in perimenopause, it's like being in a room with a flickering light bulb, and you know how horrible that is. It's on, it's off, it's on, it's off. Oh, it's on.
Yeah.
Oh no, it's off. And just as you think you're going to do something about it, it comes back on again. But obviously, you know, a flickering light bulb eventually goes out. And also that analogy of, you know, post-menopause, it is like being in the dark. So whilst the worst symptoms might be while the light is flickering, actually, once your ovaries have stopped working and your hormone production from your ovaries has stopped, it is like being in a dark room, and your body can adapt to it much better in the same way that our eyes adapt to being in a dark room. But we have 90% less estrogen in our bodies, and that has a really profound physical impact on us in terms of our bone density, in terms of our cardiovascular health. So, you know, probably my biggest message to women is your bodies are not the same after menopause. Midlife is the time to work out how to look after yourself, because you cannot get away with, from your 40s to 50s onwards, what you could in your 20s and 30s, because you haven't got the protective effect of estrogen. So yeah, which is why you know, it's great to work with you guys who are, you know, medicine is a tiny bit of this journey in midlife, but it, you know, it is an important bit.
Yeah, no, it absolutely is. And yeah, it's something obviously James and I talk about all the time, is the lifestyle factors. And that's why we love you so much, is because you really value it, of course. And I know that you give lots of advice and support to the women that you work with around those lifestyle factors as well. But they're so important. You can't stress enough how you need to get it sorted as early as possible, so that you're not down the road and having to do it when the estrogen has depleted.
It's interesting. We have people come to us and go, "Oh, I'm only in my 30s. Is it too early for me to start thinking about this?" We say, "Well, no, because it's coming down the road at you." So
absolutely.
You know,
and it's like all things, isn't it? Is that if you established healthy habits when you're feeling well, it's then much easier to continue them when you're not feeling so good. And you know, and if you know, because many women, when they're perimenopausal, really may feel like they just want to hibernate, sit on the sofa, eat chocolate, not move. And actually the really difficult, you know, the other thing I say about menopause is it is a bit like sort of death by a thousand cuts. You know, you've got lots of little things going on. Each individual one might not be enough to make you feel like you're going to do anything about it, but together can make you feel really awful. But we often don't put it all together, and not least, we're going to talk about how you talk to your GP. But one of the issues is that we've been taught to think about individual symptoms and not to link everything together. Yeah. So we're often not very kind to ourselves. You know, actually there could be lots going on, and be feeling pretty rotten, could be feeling like we don't want to do very much, and then we beat ourselves up about it. So mentally you start that downward journey, and then everything adds, and you get this negative spiral. And of course, the difficult thing is that actually, if you can, even if it's just getting outside to go for a walk, you know, talking to a friend, not hiding away, those things actually make a huge difference. But if you haven't put in place either your networks or your exercise habits, it's much harder to start that when you're feeling not so good. So yeah, I think having that in place is really key. And it also means, and I'm a really big fan of those sort of networks of support as well, that you've got other people you can go to, you can ask, who can recognize the new stuff that's going on, because sometimes we don't recognize it ourselves.
No, and you can feel super alone, really alone with it.
I love what you're saying there. You say the best time to plant a tree was 20 years ago. The next best time is today. You know, get going.
Absolutely.
All the time, people have got to kind of their 50s and maybe haven't had the history of like exercise or good nutrition habits, and they really can struggle to get into that.
Yeah.
So if you are listening and you're thinking of, I should start learning about this earlier, yes, it will benefit you.
Absolutely. Definitely. And you just mentioned there, one of the things that we're going to talk about, Katie, is look, we get asked this a lot, and obviously we're not with a medical background, but we get asked this a lot, and that's why it's so wonderful to have you on, because you've got a lot more experience with this. But we get asked, like, and we do hear it a lot, and I hope you don't mind me saying this, but that women go to their GP and they are just fobbed off. They're told that they're too young to be going through perimenopause or menopause, that it can't be that it's obviously anxiety or depression, so they need to be put on antidepressants, and they just get fobbed off, and they're left feeling so, it's almost like a bit embarrassed, a bit shameful, and a bit like, oh my goodness, I'm imagining it, I just need to crawl back in my hole again. So that is quite, until people like you have come out into the open and helping so many women, that's quite a common thing even now. And we wanted to have you on to talk about how women might be able to approach their GP and the sorts of things that they might want to say or discuss in order to start kind of getting the best help for them.
Yeah. So, I mean, and so I'm going to come at this from having been an NHS GP for over 20 years. I actually, sort of disclaimer, I left the NHS in March, not because I don't love it, but because my private clinic is so busy. And I really hope that I can take a bit of pressure off the NHS with the work that I do, but also because I'm looking after myself. I've got a 6-year-old son and I want to get the balance right. But so I have a lot of experience. I have a lot of friends who are GPs. So, and I have a lot of, obviously I see the experience of my clients and what they tell me about what's happening with their GPs. So I think I've got a pretty good overview of it from all sides. So the first thing I'm going to say is, whilst at the moment we can't turn on a radio, open a magazine, turn on the telly without someone talking about menopause, I want us to go back only about 2 years and remember the time when, for 20 years, we haven't talked about menopause. There was a big study called the Women's Health Initiative, which was the first study that showed that there was a link between breast cancer risk and combined synthetic HRT. And overnight, everyone stopped their HRT, doctors stopped prescribing it, and we stopped not just talking about HRT, but really talking about the menopause. Now, I think it's really important to go back and to understand how doctors felt at that time. So I was a trainee doctor. And I literally, I remember the week before I was having a tutorial about all of the health benefits of HRT and how to prescribe it. And then the next week we sat in that same tutorial and my trainer said to me, the first thing is do no harm, Katie. And perhaps we have, without realize, with best intent, been doing harm to women. And so that is the attitude that doctors had, they wanted to help.
Then. Wow.
And actually, so we knee-jerked. We felt like we'd been doing something wrong and we knee-jerked. And we knee-jerked from the best place because we wanted to do right for patients and we were worried we hadn't. And then what's happened is, so there's that knee-jerk reaction. People felt very worried, very scared about prescribing something. There were some fantastic doctors in the meantime going, hang on a second, let's just actually look at what this study actually showed us. Let's just really go back and understand that HRT isn't the evil thing, but a lot of fear built up, not just in the public, but amongst medics as well. And what also happened is that we stopped getting good training. So it's not that GPs and gynecologists, I really want to stress this, isn't just GPs, it's gynecologists. Gynecologists are surgeons. Their job is looking after your pelvic organs. It just so happens that your ovaries that produce hormones are a pelvic organ. They have effects all over the body. So some gynecologists are experts in menopause, but not every gynecologist. So I think there is this sort of bit of a knowledge gap where people think, oh, I'll just go and see a gynecologist and they'll know. And often they don't either. So gynecologists and GPs will get taught what menopause is physiologically, but really that's pretty much it. And up until, I don't know, I'd say about 5 years ago, it was really hard to find good menopause training. Now that has really changed, largely thanks to people like Louise Newson. The British Menopause Society have done a huge amount. And now there is good quality training out there. But even then, it is still quite a big thing for a GP to say, I'm going to spend a day learning how to do menopause. When, you know, as a GP, you have to be aware of everything. So I guess I'm just trying to set that context to say that for many GPs, they're starting from a point of a lack of knowledge. So when you approach your GP, when they say you're too young, I don't recognize these symptoms, it may honestly be because they don't know, that it's, you know, that they genuinely believe what they're saying. They're not trying to be difficult. They don't know. So what do you do about that? So the first thing I'm going to say is just do a little bit of research. I think almost every GP practice will have a website. And if you go onto their website, they'll have a little profile that says about the doctors. And go and find the doctor that says they have an interest in women's health. Don't go and see the senior male partner who, to be honest with you, is least likely to have an interest in women's health. I mean, he might do, but, you know, see the person who's most likely to be up to date. Because I think, you know, whilst you might be feeling really awful, I think the thing to remember is that you don't actually need an appointment tomorrow with any of the doctors. What you need is an appointment with the right doctor. And if you do have to wait a bit of time for that, that might be well worth the wait. Yeah. So first of all, look and find the right doctor. Second of all, inform yourself. So, and I'm not talking about spending hours and hours and hours on Google, because actually I think that can be very, very difficult. But what I mean is
the old Dr. Google.
Yeah, which and so, you know, and whilst I know that some of the menopause communities out there, women can find very helpful, I also know that people find, you know, the chat rooms incredibly overwhelming. Yes. Because people are often talking in quite a lot of detail about things, sorry, croaky voice,
oh bless you,
that are medical. So I would step away from the chat rooms. I would go to one of the 3 places I'd recommend to go to for information. The Women's Health Concern, which is the public facing arm of the British Menopause Society, has got lots of really good information. What is menopause? What is HRT? Louise Newson's Balance website is fantastic, and her videos, she's a GP by background, and you can tell in the way that she approaches things, very good. The other one is a website called Rock My Menopause, and if you're someone who likes bite-sized bits of information, they have great one-pagers on bits of information. So those 3 websites are good. Pick one, don't look at all 3. Watch a video. If you're finding reading too much overwhelming, you know, watch a video. If you like books, Kate Muir's book, Everything You Need to Know About Menopause, We're Too Afraid to Ask, that's the best book I would read. So inform yourself, and then fill out a green climacteric scale. So the green climacteric scale is a menopause symptom checker. It is an internationally validated scale of menopause symptoms. And you can find that on the Balance website, you can find it on the Women's Health Concern website, you can find it on my website, and it's literally a tick list, and it goes through, I don't know, there's about 20 questions. And if you are scoring highly on those questions, one, I think it is going to help you to understand that there is a higher likelihood that your symptoms might be menopausal, although the symptoms of menopause are diverse and many different things can cause them. But also GPs love a validated tool. You know, they love a bit of evidence.
You take this.
So
yeah, you're doing your prep to take in, basically.
You're doing
exactly that. So you know, what's the army phrase? Proper preparation
Planning
prevents
poor performance.
Yes,
Yeah.
exactly.
Yeah.
So just a little bit of planning. The other thing I'm going to tell you though that doctors hate the closely typed 6-page A4 set of notes that the patient says, "Doctor, I thought it might be helpful for you to read this before we started."
Oh, wow.
You know, you're gonna just go, oh, heart sink. But so what the doctor needs to know is that you're informed. They don't need to know all the knowledge you know, but you can say to them, "I've been on to the British Menopause Society website. I understand the NICE guidance." So NICE is the National Institute of Clinical Evidence. They wrote a menopause guideline that basically said, and for many women, the benefits of HRT outweigh the risks. I've done a green climacteric scale. This is why I think my symptoms are menopause and not anxiety and not depression. And I would like a trial of HRT. And so you can say something very simple. You can say it in a very non-confrontational way. But you've done your prep. You're not overwhelming the doctor. And I think that allows you to work in partnership with your doctor, because you're setting out your expectations, so the doctor has a clear picture of what it is that you want. Because I think the other thing that some people will do is they'll say all their symptoms and they'll be knowing what they want the doctor to say, but they've not actually said it. Well, just say it. Say what you want. Say why you booked your appointment. That's a much easier place to start from.
Yes, actually say, you know, I want to have a trial of HRT, rather than waiting for them to say it. And I think I'm not with the HRT thing, but I think with doctors, you know, I've probably done that, where I've gone in and thought, okay, I've got the expectation of what I want them to say, but I haven't actually voiced it.
I think know in this area that if you've done that little bit of research, you're as likely to be as informed as your doctor is. So I know that might not fill people with lots of.
No, that's good. I think it's empowering.
Just have that in your mind, you know. But don't go in for a battle. Go in for a good chat. Because if you're defensive, the doctor will pick that up. If you're open, the doctor will pick that up. You know, I just think see this person at the other end of the phone as a human being, because that really helps. Because that, you know, a human being who might have a cold, who has a good day and a bad day, who, you know, is trying to help you. You know, that's the other thing, is that most doctors really do want to help.
And I think that's such an important thing to say, because energetically you can go in. And I think because there is so much on menopause, and it's great, but even what I've just said, you know, that all the women, there's a real furore, isn't there, around, oh, my GP said that, my GP was terrible, blah, 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 blah. So we're all building ourselves up into this massive frenzy.
I know you won't like HRT. I know you won't like what I'm going to say, kind of thing. And I think sometimes we can be, and often menopause makes us people that we wouldn't normally be. We are a bit more angsty anyway.
Yeah.
So
exactly.
I think it's that trying to step back from that. The other thing I would definitely say is, so research who you're going to go and talk to, but be prepared to wait for an appointment. Don't try and book the soonest possible one. You know, see if they'll give you a double appointment. They probably won't have the capacity to be able to do that. So don't get too het up on that. It depending on what suits you. Many GPs are now offering face-to-face appointments, and you might find it easier to do this one face-to-face rather than to do it over the phone. I think it's different if you know your doctor. I think a phone call is fine if you know your doctor, but do consider saying, could I come in and have that face-to-face? The receptionists are probably primed to want to put you in as a phone call, because that's most straightforward, but you're allowed to ask for a face-to-face. If you don't ask, you don't get. The other thing to say is that I think if your practice is still doing it, e-consults are your friend, because you can put everything down in an e-consult before you see the doctor. You've had a chance to download it. The doctor's had a chance to read it in a format that is helpful for the doctor. The actual questionnaire for perimenopause symptoms takes you through a lot of the things that a doctor will be wanting to know. And it, you know, because I think you can feel that time pressure of a 10-minute appointment and feel like you haven't got it all out. So I really think e-consults are very helpful for you to be able to feel that you've been heard.
And are they available at all doctor surgeries, e-consults?
Not all doctor surgeries do them.
Okay.
The vast majority will, though.
Okay.
So if you look on a doctor's website, you'll see whether they do them or not. The vast majority will. If they don't panic. Just think about what we've said already. Do your prep and go, write yourself a couple of little notes. But also, you know, the doctor doesn't necessarily want to know or have time to know every single little bit of everything. What you want them to do is to have an overview. Because the other thing that I see a lot of women say to me is, you know, I have an hour with women and I do have time to listen to every bit of everything. And I find that really, really valuable. But actually the reality is that GPs are under huge pressure at the moment. There aren't enough doctors out there to meet demand. Actually, in 10 minutes, to be able to fully listen to somebody and fully explain HRT and how to use it is a lot.
It is a lot.
So actually, if you can either use the symptom checker as a look, here are my symptoms, if you can have filled out the e-consult, but don't feel like you have to go through absolutely everything. You can, Tracy, you know, write yourself, but you know, what's my elevator pitch? How do I say my symptoms in 2 minutes?
Yes, I love that idea. I love that idea.
And then I think if there's a specific kind of HRT, Louise Newson does a great easy prescribing guide for GPs. The British Menopause Society do another one that basically says, you know, you want to go and ask your GP for a through the skin estrogen with either a coil or micronized progesterone. That's the basic thing. And so, you know, you can say that to your GP as well. If the GP doesn't appear to know about that, I would just say, okay, would you mind if I sent you a link to have a look? Or is there another GP who, you know, you can, or sometimes a pharmacist will know some more. And I think it's fine to pause a consultation rather than getting into a point where a doctor's feeling uncomfortable because their knowledge might not be up to,
right,
you know, so because if someone feels threatened, they're more likely to say no or to give you an alternative. So, you know, some of this is just human psychology.
Yeah, as we're jumping in, to give the GPs some slack, like they do an amazing job. They have to cover everything.
General practitioner.
Like in your experience, like how much training would a GP get on menopause over their entire medical training?
A lecture.
I'd say so. One lecture. And that might.
And if we just think about the fact that 51% of the population are women. Every woman who lives long enough is going to go through a menopause, and you know, probably 80% of women are going to have some symptoms. It's getting better. It's getting better. You know, Diane Danzenbrink's amazing campaign, and you know, the campaigning in Parliament. I've got my brain. I can't remember what amazing Welsh MP who's been doing all of the
yes. But
amazing lady, Carolyn Harris.
That's it.
You know, the main thing they're campaigning for is education for all doctors, education in school, and menopause in the workplace. And, you know, and that's pretty brilliant. So it is changing. But just remember that a lot of GPs will have been sitting in their seat for 20 years. So, you know, new students coming through are getting more.
Yeah. Right. Yeah.
So, the other things I was going to say just about trying to get the most out of your GP appointment is that, so what I see patients coming in to say to me is, well, here's the HRT my GP prescribed me, but I don't feel they really listened to me, and I don't feel that they really explained it to me, so I haven't taken it because I don't feel confident. Now, I completely get that, but I also think I would say take the win of the prescription. You've got a prescription. Go and see whether your pharmacist will chat to you about how to take it and how to do more. Go and have a look at some of the videos on Louise Newson's website or on the Women's Health Concern, the British Menopause Society website, that talk to you about how do you take this stuff and what are the pros and cons. So in a way, don't put such huge expectation on a 10-minute appointment. Because yes, the ideal is to have enough time to properly talk about your symptoms, for the doctor to go through exactly the right regime for you and to explain exactly how to take it. But that takes me an hour when I see my patients, and you have 10 minutes. If you really don't understand, book another appointment to go back and get it explained. But it doesn't just have to be your GP. You know, sometimes there'll be a nurse in your practice who will know. Sometimes there'll be often pharmacists are really knowledgeable, but there is a lot of really amazing information out there on the web that you can use yourself to inform yourself. And then the other thing I'm going to say is that getting started is just the very first bit of your journey. And for anybody, that's true of any medicine, but particularly for through the skin HRT, because everybody absorbs it differently. So it is very likely that your regime may need to be changed and adjusted at some point. So every woman should have a 3-month follow-up. And if that's not booked in, you book it in. And the other thing to say is that you don't feel that you have to wait for 3 months. So if you're having side effects, some side effects will settle. Some symptoms after a couple of weeks will just go away, like breast tenderness, a bit of abdominal pain, maybe a bit of spotty bleeding can last for 3 to 6 months. But most symptoms shouldn't be severe and they should settle. And if you were feeling worse on your HRT than better, go back to your GP. And if your GP isn't able to see you, go and talk to the pharmacist. So it's just those things about, I do again see some people say, well, I was told I just have to give it the full 3 months, and they're feeling absolutely awful. You shouldn't feel absolutely awful on HRT. Go and get some help. And pharmacists are often really, really helpful.
So even that piece of knowledge, go and speak to your pharmacist. I mean, that's like gold dust, because there's people sitting there, like you said. I mean, we hear it a lot. Even some of my clients have just been saying exactly the same thing. I've been on it 6 months now. I don't feel like it's working for me. I don't feel like it might be strong enough, blah, blah, blah. But I've been told that, I need to wait. I need to let it settle. And I'm thinking, how long do I need to let it settle for before I start feeling better, or go and get another checkup? So even going.
So as my general rule of thumb, in terms of how quickly do you respond, I would say that for hot flushes and sleep, they are to do with levels of hormones. So once you are absorbing that medicine, so normally within, sorry, that's the dog making us.
Oh, don't worry.
Normally within 10 to 14 days, your levels of hormones are going to be relatively stable. So most people with hot flushes and sleep and muscle and joint aches should be noticing a difference within about 2 weeks. So I tend to say to women, 2 to 4 weeks of a low dose, then increase a little bit. Other symptoms like brain fog, like energy, like mood can take longer to respond, up to 3 months. Libido can take up to 6 months. So some symptoms take longer, but if you are still having drenching night sweats, really awful hot flushes, a month into your HRT regime, it's very likely that you're not absorbing that HRT that well. And the other thing your doctor needs to be thinking about is, if your HRT is good and you are absorbing it and you still have those symptoms, hang on a second, maybe they're not your hormones. Maybe you need to have some other investigations. So there's many things that a doctor should be thinking about. But as a general rule of thumb, hopefully that's a helpful kind of little time scale to have in your mind.
Absolutely, honestly, as always, I'm just sitting here completely fascinated by all this, because even I think that is such a relief that you, especially with the application and the dose and like how to actually use your HRT, whether when I get further down the line, whether that's something that I choose to do or not. I think even for me, looking down that road and down that journey, thinking, okay, well, if I can't get the advice straight away, I can't get an appointment straight away, you can go and speak to someone else that's qualified that can, help you.
Realistically, a doctor isn't going to have the time to sit and actually talk you through how to use it, but it is really important to use it properly. So it's really important that your patches stick. It's really important that you let the gel dry. It's really important that you spray the spray on your arm and not waft through it. But, if you... I say that, but when you're menopausal, you're not thinking straight. So you do things that you wouldn't normally do. We're all intelligent women, but we do funny. Exactly. Oh, bit of perfume. little bit of estrogen. You should be watching us because we're doing a little perfume waft now.
Exactly. We're on video right now, people. We're just we're pretending we're perfume wafting estrogen.
Yeah. So unfortunately, most of it is going to be going into the air of your bedroom or your bathroom, if that's what you're doing. It needs to go onto your arm. But if you, as I say, particularly Louise Newson's website has got little videos on how do you put the stuff on, how do you take utrogestan. You take utrogestan at night because it's sedative, and that's why you take it at bedtime, and just things like that in a busy 10-minute consultation you might not quite have the time to go through. So I think my tips are: prepare yourself, think of your doctor as a human being, but also don't be afraid to use trusted places to get other information, but pick your place and stick with it. Don't Google at 11 o'clock at night, because you will terrify yourself. Even going on the forums to say, how do I use this? You'll get 20 different pieces of advice, often from non-medically qualified people. So go to the places where you've got a qualified professional telling you what to do.
Yeah, absolutely. And I think also the moral of the story is also, the expectations we have on GPs. And like you said, us women, when we're going through perimenopause and menopause, we're just a bit angry and cross potentially. And it is what it is. It is that we are in the situation we're in. They've got a 10-minute slot. They're completely maxed out. We can't change that. So we have to take responsibility for our own.
And from the other side, I've got lots of friends trying really hard to do a really good job as GPs and finding it really difficult to be the kind of GPs they want to be. They don't love telephone consultations either. They don't like having the time constraints. So it is that whole, okay, this is not an ideal situation in general practice in the UK at the moment for doctor or for patient. That's not okay, but let's try and make the best of it. It's a bit that whole there are some things you can't change. Yes. So let's do what we can do.
So one of the things as well, Katie, that I hear a lot is women talking about tests, like hormone tests, and going to their doctor and asking them for tests, and then some doctors say no, and then some doctors say yes, and how effective are these hormone tests about telling them what's really going on? So I don't know if you could just kind of shed some light on that.
Yeah, so I think that this is an area of some confusion and some controversy, and it's also an area where you can spend a lot of your own money not necessarily helpfully. So the blood tests that are classically used to diagnose menopause are a blood test called follicle stimulating hormone, an FSH, or an LH luteinizing hormone. They're brain hormones produced by the hypothalamus. They're produced in fact, maybe the pituitary gland. I need to go learn my brain physiology. But they're produced in response to the ovaries not working. So you think of them like a whip to the ovaries. So in menopause, their levels go up because they're rising to try and get the ovaries to work. Now, the thing with these hormones is, one, they only rise about a year or two before your periods actually stop. And two, they fluctuate. So they fluctuate naturally throughout your cycle, and they fluctuate a lot in perimenopause. So they are a very, very difficult and largely unhelpful one-off test to do for most perimenopausal women, because of those reasons. So very helpfully in 2015, NICE, the National Institute of Clinical Excellence, when they wrote their menopause guidance, said to doctors, in a woman over 45, do not use blood tests to diagnose the menopause. Diagnose the menopause on symptoms, because this woman's ovaries are going to be shutting down. If they're symptomatic, you don't need a blood test. And a normal blood test does not mean that that person is not perimenopausal. So one of the things I then hear, though, is that there's the women between 40 and 45. What has often happened is that GPs have gone, right, I'm not meant to do it over 45, but I must do it under 45. So they'll then do it under 45. And of course, it's even less likely under 45 that those hormones are going to be abnormal, basically because FSH and LH just don't rise until further along in the process. And yet we know that hormone fluctuations and hormone change happens 10 to 15 years before your periods actually stop. So when I teach GPs, I say to them, relax about the need to have a blood test to diagnose something. If you have a blood test and it comes back as a high reading, well, that's helpful. If you have a blood test that comes back low, it really doesn't tell you very much at all. Yes, you can repeat it a lot of times. It might tell you more, but actually go on the woman in front of you, go on her green climacteric scale, go on her history. Use blood tests in a woman between 40 and 45 if you think something else is going on. So if you don't think this is menopause and you want to check her thyroid, you want to check her B12, you think she might be anemic, then do blood tests. But actually largely between 40 and 45, blood tests are not helpful. When you're postmenopausal and you're not having periods anymore, blood tests literally are not worth any money at all, because you will not be producing any estrogen and your FSH will be high. That's just a biological fact. The only thing in all of this that can be helpful is to measure a baseline testosterone level if you're already on HRT and you have a low libido or you've got low testosterone symptoms. Testosterone is produced by the tissue of your ovaries. It doesn't fluctuate about all the time. It drops from your sort of mid-30s onwards. So that can be helpful. But that's that's not about diagnosing. That's about, I'm on treatment already. Blood tests can be very helpful through the skin medication when we're trying to work out, are you absorbing the medication?
Right.
The diagnosis, no. My only other caveat is if you are under 40 and you are not having periods, it is really, really important that you have proper blood work done up, because you need to know, have you got a premature menopause? We call it premature ovarian insufficiency. That's a very important diagnosis to make. And it's very important that that diagnosis is made and you get correct treatment, i.e. you were put on HRT and you stay on HRT until you were at least 50, because that's an very unnatural state for your body to be in. So like if your thyroid suddenly stopped working, it would be important you know about it. So under 40, definitely need blood tests. Between 40 and 45, not unless something else is going on. And if your blood test is normal, it does not mean you're not perimenopausal.
Mm-hmm. I think that's really interesting, actually, you say that, because there was a break where our dog Lola had a little accident on the floor because she's not very well. So we were actually having a chat, weren't we, Katie, in the little break where we had to pause recording, because I went and had my test done last year, like bloods, and I was 42 then, and I was having some perimenopausal symptoms, and I was really surprised how quickly they gave me blood tests. And actually I didn't know what you've just said, so I'm like, oh, that's very efficient, that's amazing. But actually it might be because some GPs
and I'll hear lots of women then go, oh well, I've had my blood test and they were normal, so it isn't perimenopause, okay, I'm going to think about something else. And I think what I just say to women is that a normal blood test doesn't really tell you anything. An abnormal blood test does tell you something.
Wow.
Sorry, got my dog suddenly in the
I know. Oh my goodness, is it a boy or a girl?
She's a girl.
Oh, she's gorgeous.
But she's also soaking wet. She's obviously just been for a swim.
Well, that'll be a lab for you. Our one dances around water. She's like,
so funny how they're all different.
She's like that. No, I don't like water. I'm going to go round it. That's super, super helpful, Katie. Again, unbelievable. I think we've covered so much ground there. Again, I didn't think it was possible, but I'm at the end of this podcast going, oh my goodness.
Wow.
Amazing.
Fantastic.
Thank you so
much.
You are like a light for so many women, me included. It's kind of, it is, knowledge is power, like you said right at the beginning. It's awareness and, it's awareness and making sure that we're being compassionate with ourselves, basically. So thank you so much. Are there any other kind of things that you feel like a burning desire to say at the end?
So, I mean, I think just following on from what you've said, it's that be kind to yourself. Yeah. Pick a source of information and stick to it, but also be kind to your doctor.
Yes.
that would be, and I think, my grandmother always said to me, treat everyone as you'd like to be treated yourself. And I think that is a good way to go through everything in life.
Yes, I love that. Mine was always, If you can't say anything nice, don't say anything at all. I love that one.
So I think probably both of those are a very good thing to think about when you're going to see your doctor.
It's been so enlightening and really, really balanced, a really balanced look and a balanced perspective. So thank you so much, Katie.
Yeah,
You've been
an absolute pleasure.
Thank you. Lots of love.
Lots of love. Bye.
Yeah.
You've been listening to the Midlife Mentors with Claire and James Davis.
We'd love to hear from you, so drop us a line at info@themidlifementors.com with any questions or topic suggestions.
And make sure you join us on our Facebook page and YouTube channel. You can find us under the Midlife Mentors.
Yeah.